Welcome to the latest webinar from the Laser and Skin Surgery Center of New York. Today, we are here to talk all about fat grafting and facial rejuvenation and body contouring with our amazing plastic surgeon, Dr. Wilson. Dr. Wilson joined our practice about a year ago, last year, and he is fellowship trained in aesthetic surgery. He joined the practice along with Dr. Hoffman to bring the special area of aesthetic surgery as an area of expertise to the Laser and Skin Surgery Center of New York. And he is highly skilled in the full gamut of plastic surgery procedures. So although today he's speaking about fat transfer, he also is amazing with everything from facelifts, neck lifts, rhinoplasty, breast augmentation, tummy tuck, mommy makeovers, and everything in between. So if you have any questions about plastic surgery, you have definitely come to the right webinar. And I am excited to hand this over to Dr. Wilson, who's going to teach us all about fat grafting today.
All right.
And at the end, he will have time for some question and answer. So if you have any questions, you're welcome to put them in the Q&A feature on Zoom, and we will get to as many as possible at the end of the webinar. So Dr. Wilson, thank you so much for being here today and sharing all of your time with us. And we are ready to learn about fat transfer. The floor is yours.
Risa, you are too kind. And thank you everyone for joining. Today, I'm going to be talking about fat grafting for facial rejuvenation and body contouring. I have no disclosures, but what I will say is all of the patients that I'm going to show today have given me permission to share their photos. So please no screenshots if possible. Just a little bit about me. This is me third in from the end of this hardworking and talented group. I went to NYU School of Medicine for 4 years. I graduated AOA. I did a 1-year dedicated research fellowship. I then went to NYU for a plastic surgery residency. And during my 6 years, there was actually the best plastic surgery residency in the country. And then I went to the oldest and most prestigious aesthetic surgery fellowship in the country at the Manhattan Eye and Ear up on the Upper East Side to learn from the best of the best. And then I hope to bring some of what I learned there to share with you tonight, but also to bring to the Laser and Skin Surgery Center of New York. Some of the procedures that I perform are facelift and neck lift, brow lift and blepharoplasty or eyelid surgery, rhinoplasty or nose surgery, aesthetic breast surgery, male chest surgery, abdominoplasty or tummy tuck, liposuction, and then Brazilian butt lift, also known as fat grafting to the butt or hips. But today specifically, I'm going to talk about fat grafting, or taking your own fat and using it as a building block for aesthetic surgery. And I feel very strongly about this, and I've even published on fat grafting. So I'll share some of the data that I came across during my review. And going back to the procedures I perform, in blue, you can see all the areas in which I feel that fat grafting takes my results one level up. So facelifts and neck lifts, brow lifts and blepharoplasty, breast surgery, chest surgery, liposuction, obviously fat grafting to the hips or butt. So these are all areas where I feel like fat grafting can help my results and help my patients. So why do I think it's interesting? I think it's interesting because you're taking fat away from areas that you don't want, your upper arms, your abdomen, your flanks, your inner thighs, and you're adding it to places that you do want, whether that's the hips, the breast, the butt, or face for facial rejuvenation. Even men can get the illusion of better muscle contour by adding fat to places like the pecs or the delts. So even men can benefit from this procedure. Some indications for fat grafting are facial aging. That's most common. We all know about facial fillers, but actually you can use your own fat in a very similar way to give a long-lasting natural result. Also breast augmentation, most notably with silicone or saline implants, but you can actually get less of an augmentation, more of a breast boost. So a smaller increase in volume from your own fat. Chest augmentation, as I just mentioned, buttock and hip augmentation, post-mastectomy breast reconstruction, hand rejuvenation, and then congenital, traumatic, or surgical depression. These are all medical ways where you can use fat to help scarring and fill depressions. So today I'll talk about my outline for today will be a brief history of fat grafting. I'm going to be talking about some of the science behind the art. I'll talk about potential donor sites, surgical techniques, and area of potential benefit. So some of the timeline of fat grafting: in the late 1800s, Franz Neuber first used fat to reconstruct the face. So it's been around for a long time. A few years later, Silex claimed good cosmetic result for periorbital scars. In the early 1900s, this was first used with a needle and syringe transfer. And then in the 1920s, similar to what we do today, we use a metal cannula for fat transfer. And at the time they were using wax, but they quickly learned that fat is a good alternative. In the 1980s, fat was described for facial fat grafting. And then in the 1980s, when liposuction became very popular, they used fat to correct liposuction contour deformities of early liposuction mistakes. And then in the 1990s, Dr. Coleman developed a reliable method for fat injection. And this has kind of taken hold in what we've used over the last 30 years. So some of the science behind the art, there's the fat harvest, what we do with the fat in between when it's outside the body, and then fat re-injection. So going on step one, the first part of successful fat grafting is the graft harvest. And you can essentially do this any place where liposuction would be beneficial. So we talked about the arms, the abdomen, the flanks, the inner thighs. And it's important to note that this can be performed even in patients with low BMI. There is always some fat. So you can see the model here pinching, and yeah, you would say this woman has no fat, but you can find fat on anyone, especially if you're doing low volume for facial rejuvenation. So what is liposuction? Liposuction is where you use a tumescent or numbing fluid and you inject it under the skin into pockets of fat, and then you ultimately remove that fat. There's local anesthesia similar to that of the dentist, so you don't feel it. The fluid has a medication that actually constricts blood vessels, epinephrine. So it constricts the blood vessels. So when you actually take the fat, you're getting just good fat cells and very little blood. And this can all be done through very small incisions in the skin, less than 1 centimeter, and it can be removed with a small cannula. So having very small scar burden, you can actually do quite a lot of surgery. A cannula ranges in size from less than 2 millimeters to 5 millimeters or even greater. And this is very little consequence to you, but what I will say is that smaller cannula does not necessarily mean better. These are actually living cells, and you want to damage them the least amount as possible. And so fat is more viable if it's harvested with cannulas greater than 2 millimeters. So that's what I do in my practice. I use slightly larger cannulas to harvest fat so that the fat cells have the best chance at survival. In terms of harvesting the fat, this can be done under general anesthesia or wide awake under local anesthesia. So it all depends on the volume that we're looking for and the amount of surface area. The limiting factor is the numbing medication. So if you're going to do a full body, or you're going to do back and abdomen and flanks, you really want to probably be under general anesthesia. But if you just want to do for facial rejuvenation, take a small volume of fat from the flanks or the lower abdomen, can be done very comfortably under local. Some potential donor sites, as we mentioned, are abdomen, flanks, back, inner thighs, upper arms, under the chin, to get rid of the double chin. And it all depends on the volume we're looking for. And going down to step two is processing the fat. And there are many thoughts on this with varying amounts of science. So after the fat is taken out, it's what are we doing with it? And there are active processes, passive processes, and closed systems. Some of the active processes are centrifugations or spinning, they're straining. Some people say that you should wash the fat with fluid or rolling it out on non-adherent gauze. I will say that there is no evidence to suggest superiority of centrifugation, straining, washing, or rolling the fat to increase the fat graft survival. What you do want ultimately is to take fat and re-inject only the fat. There's no point in re-injecting the fluid that you use to mess the fat. So using a passive system like this, you can actually let the fat decant. The nice fat cells float to the top because they're lipids, and then the heavier fluid and a little bit of blood goes to the bottom, and that gets decanted off and thrown away, and then we only use the nice yellow clean fat. And then there are fancy systems where you can actually suck the fat into a canister. It never sees the air, and then similarly, it's decants, you get rid of the fluid, and then ultimately re-inject the fat through the same canister. But again, there's very little data to say that this is better than either of the aforementioned processes. Going to step three, the final step is the grafting of the fat. And as we mentioned, fat can be used throughout the body for aesthetic purposes, whether that's the hips, the butt, the breast, the face. But the one thing I will say, it's believed that it's best to place the fat in small pea-sized collections in a lattice structure. These are living cells. So if you imagine you put a big globule of fat under the skin, and the center of the fat needs to find a blood supply. So the center of that globule probably isn't going to see as much blood or nutrients that the outside of it is. But if you place the fat in small pea-sized globules in a lattice framework, more of a spray paint, then you give the fat the best chance at survival and finding a good blood supply. It's important to understand that not all the fat that is grafted survives. Anywhere between 40 and 80% will survive, and this is based on many factors. And the fat that does not survive typically is reabsorbed by the body. Very rarely it can lead to some more less desirable outcomes that need to be addressed, but this is the exception to the rule. So going on to some clinical cases, these are a few ways in which I feel that fat has helped my results. And I'll say that fat makes butts look better. So this is a very nice 25-year-old woman. She didn't like the volume of her back. She definitely didn't like the volume of her lower back. And she felt like her butt both didn't have the volume and didn't have the shape that she wanted. So what we did is we planned to take fat out of her back, her love handles, and then add it to both shape and give volume to her butt. And you can see here, it really changed the dynamic. She went from being widest at her love handles to now having a skinnier waist and just an athletic lower butt. You'll see on Instagram, some people make very large butts. That's not my aesthetic. That's not the surgeon I am, but something like this where you're adding some volume, but really using it for shape is, I think, is a very aesthetic procedure and something that I find gratifying. Similarly, this is a 31-year-old. She works out 6 days a week, and despite working out, she has the stubborn fat of her lower back and love handles. She also has very nice legs, but she has muscular thighs and felt that the junction between her thighs and her hips, her hip dips, were bothersome. She wanted that filled out so she could have a better contour. So similarly, we want to take fat out of her back and her upper back and lower back, and then add it. You can see on the lateral aspect, the hip dip. She really wanted that to be filled in. So you can see here now she has a nice contour from her legs to her hips, to her lower back, to her upper back, and it's more of a hourglass shape that she was looking for. And this is all done through a couple very, very small incisions. Fat makes breasts look better. So this was a very nice 41-year-old woman. She had a previous tummy tuck and breast lift by another surgeon, and then she had a gynecologic procedure. You can see that second C-section scar above her low abdominoplasty scar. So she came to me, she wanted a scar revision to meet those two scars in the central abdomen. She wanted extra liposuction of her abdomen and flanks. And more than to give her breast volume, she really wanted to use fat to give her breasts shape and better symmetry. And so our plan here was to revise that scar, remove fat from the central and her flanks, and then to give her breasts more volume, and again, to help with symmetry. And you can see here, I think we accomplished that. We revised the scar, we made her abdomen smaller, brought in her waist, and I would argue that now she has a much more youthful breast with volume in her superior medial portion of her breast, but also more symmetric breast, and she was very happy. This is a very nice 44-year-old woman from South America who came for a tummy tuck. She had one child, but she's very small and actually had a rectus diastasis. And that's where during childbirth, your abdominal muscles are actually pulled apart. And what I will say is that there's no amount of crunches that will bring those muscles back together. Once they stretched apart, it really becomes a surgical issue to correct it if a patient wants that. And while she doesn't have a lot of skin, she did have excess skin that she did not like. In addition to her tummy tuck, she also wanted increased volume of her breast, and she did not want implants. So our plan for her was to do a traditional tummy tuck with muscle repair, and also at the same time do liposuction of her abdomen and flanks, and use that fat to give her breast a boost. And you can see here, she has a low tummy tuck scar. She has a new belly button. You can see how much it really pulled in her waist to give her a much more feminine figure. And if you look at her breast, you can see, yeah, it didn't give her an augmented look, but it did give her a boost that really gave her a more youthful appearance of her breasts. If you look at her scars, I don't know if you can see my pointer, but you can see just how much skin was actually removed from her tummy tuck. It's the entire skin down here, all the way from a low tummy tuck incision, all the way up to this first flower underneath her tattoo. So that just gives you a sense of how much skin was actually removed. But more importantly, I think it gave her entire abdomen and breast just a better shape and better proportions with regards to one another. This is a very nice athletic 38-year-old. She wanted larger breasts. She had baseline asymmetry. She did not want to lift. What I will say, she wanted more volume than I thought I could promise her with fat grafting alone. So she opted for small implants and then fat grafting to help give her a natural look, but also to give her a more symmetric look. So our plan here was to liposuck her abdomen and flanks, similar to the last few patients. But then in addition to putting silicone implants in through the fold of her breast, also to fat graft her superior medial breast, again, to hide asymmetries and also to hide the implant and give her the most aesthetic look possible without looking augmented. And if we look here, you can really see how much it really brought in her waist. It gave her an athletic torso. It gave her a very natural, youthful breast without looking augmented. So I think the combination of implants and fat grafting is rarely done, but actually a very powerful hybrid procedure. And again, just going back, you can see how much it really changes her abdomen and then her breast. So it takes a large torso and a small breast and gives her a more youthful breast and a small torso. And I think that combination of the plus minus really gives her just a much better look. And again, she was very happy. This is a patient I did 2 weeks ago who was nice enough to share her photos with us. She's a petite woman. She's 26, works out a ton. With clothes on, you wouldn't think she's a great liposuction candidate, but actually you look, she has a little bit of fat of her abdomen and flanks, but more so when you look at her back, her lower back really has extra volume to give. She did not want implants and she wanted a little boost of her breast. So the combination of 360 liposuction with fat grafting to her breast is what we talked about. She also wanted, similar to the 31-year-old I showed, she wanted her hip dips filled. And so if you look here, this is some of her pre-op markings. I mark her midline. You can see where I marked the base of her ribs. You can see where I mark her semi-lunar lines here on the sides. You can see her linea alba. These are areas where I want to suck, and here. She also had suction of her inner thighs and also of her upper arms. As we spin, you can see that's the area that I want to fill on her hip dip. And you can see from one very small incision on the lower back, I can really target some of that lower back very well. And then looking at her on the table, you can see again, that small incision, that's incisions a few millimeters wide. And you can see just how nice the lordosis of her lower back is, going from the pre-op to where she is there. She's taking we're taking a patient whose flanks are the biggest, and then bringing it in, giving her a nice waist, and now her hips actually are the biggest. So again, it's not necessarily size, but it's reshaping her to really change the proportions. And here you can see her from the front, where you can see how we did it in an anatomic way to really highlight her abs, and you can see her semi-lunar lines. And then you can see where she has the bruising, where the fat was replaced into her breast, and that'll give her a nice boost for her breast, nice boost for her hip dips, and then bring in her abdomen and her waist. Similar to women, men can also benefit from this procedure. So this is a very nice 55-year-old man with gynecomastia, or excess breast tissue underneath the nipple. And this is something that happens in men during puberty, and then it happens at another peak later in life around 50 or 60. And all men have a little bit of breast tissue under their nipple, but sometimes it grows with time. And so this patient didn't like the excess fullness under his nipple. He also didn't like the shape of his chest. So the plan for him was actually to liposuck his chest, to liposuck his flanks, and then also to remove the glandular tissue through a small incision in the nipple that hides very well, and then to use that fat in the upper portion of his chest and arms, where a patient normally has the definition of their pectoralis muscle. And you can see here, it just totally changes his dynamic. He went from having a flat upper chest and big, a lot of volume underneath his nipples to having very little volume under his nipples. And then the fat grafting doesn't do anything outrageous, but it just gives you the shadow, the hint of a more defined, more athletic look. And that in combination with bringing down his love handles a bit really changes his whole dynamic, and he was extremely happy with this procedure. I know I talked about some facial rejuvenation and facial aesthetics, and here I'm going to talk about how fat grafting can make the eyes and brows look better. So this is a very nice 62-year-old woman. She had baseline brow asymmetry, she had ptosis of her eyes, and she had fat pads of her lower eyelids. She would say that despite a full night's sleep, people would say that she looked tired. And sometimes with photography, it's hard to tell with the lower eyelids, but this is not subtle in real life. So the plan for her was to do a brow lift, a upper blepharoplasty with ptosis repair, meaning to raise her eyes a little bit, brighten them up. And then for her lower eyelids, it was going to be remove the fat pads, But in addition to removing the fat pads, to add volume to her mid-face. As we age, the deep malar fat pads that's just under the eye, not only do they drop with time, but they also retract and get smaller. So that, in combination with your lower eyelid fat bags, really over time gives people that tired look. And the combination of bring down the lower eyelid bags and beefing up the cheeks really gives someone a more aesthetic look. So here you can see we got her brows lifted and more symmetric. You can see where just how the aperture of her eye, I mean, it's striking. She looks tired and sleepy in the pre, and in the post, her eyes are wide and symmetric and beautiful. And while you can't necessarily appreciate the fat grafting in the photography because of the flash, I will tell you it is not subtle in real life. And if you look here on the 3/4 view, you can see this was where my pointer is. There as a fat pad and a fat pad, and then a depression. And then you look down here, and now that depression is filled. It's more youthful cheek, and then her lower eyelid bag is gone. So the combination of removing the lower eyelid bag, putting volume here, really restores that youthful look, and that in combination with upper eyelids and brows really changes the dynamic of someone's facial expression at baseline. And I think that fat makes facelifts look better. And you know, I used to do fat grafting only when people kind of asked for it or wanted it, but I've totally evolved that. I think instead of doing fat grafting 10% of the time, I do it 90-95% of my facelifts. And I really think that it's a very powerful adjunct. And like I said, if you can see my pointer, you can see that this area, this mid face, which often isn't completely addressed with the facelift because it's just not the way the operation works. Adding that volume back that we lose with age really gives someone a very subtle, beautiful change. And so if you look here, these are the typical areas that I add during a facelift: the deep malar, the superficial malar, the nasolabial fold, the marionette lines. And again, I don't add a lot, but just enough to give that patient the youthful appearance. And depending if a patient needs it, sometimes I add it to the temples, I'll add it to the chin, sometimes the lips, although the lips aren't the best place for fat grafting. We can talk about that during the discussion. But using fat during facelifts not only helps lift the tissues, but also refills the areas that were lost with age. And you can see here, it's a subtle change, but there's just something more beautiful, more youth, more vibrant, more filled in the after than before. And I would argue that a lot of it, some of it is the facelift, but a lot of it is the fat grafting. And you can see here on the lateral, you can see she had the crepey skin, the jowls, and then you go down and you can see a crisp jawline. There's no more of that crepey skin. But more than that, on the 3/4 view, you can just see how nice the cheek blends with the lower eyelid, just how nice the nasolabial fold, just how nice the marionette. All of those areas that were depleted with age really just come back to life with fat grafting. And I think the combination of facelifting, neck lifting with fat really gives that a very nice youthful, natural appearance. And I just want to point out, you know, this is a darker patient who ultimately their scars tend to be worse on whole. And you can see with a facelift, the old school facelifts from 20 years ago, a lot of people would pull on the skin too tight and you'd have that windswept look. The modern facelift is a small incision in front of the ear, hidden in the ear. You can see my cursor, and then around the ear, and everything else is hidden behind. The skin is gently lifted, and then the structures from underneath are tightened. So I think, and then when the skin is ultimately redraped, only a small amount of skin is removed. So it's really not a skin operation. And I think that's really important because it's really to tighten underneath and to give a patient a more refreshed look rather than a pulled look. And I think that is very important distinction. And getting to the end, I'll say that not all fat makes facelifts look better. This is a very nice 68-year-old. I felt very badly for her. She had a facelift performed in an outside country. And they thought they were doing her a favor by fat grafting, but they fat grafted in the wrong place. In general, fat grafting, as I mentioned, in facial rejuvenation should be below the tear trough, so in the mid face. They fat grafted straight into the lower eyelid, and I'm not sure why, but she came and even she would say that people thought she looked angry, and this was one of the nicest patients I've ever taken care of. So I went in and I redid her lower eyelids, and I actually picked out the old fat graft. And this case really shows that fat sticks around, because I wouldn't want fat to stay from the places that they placed it. But I went in and I did redo lower eyes, redo upper eyes, and I redid her facelift. And you can see here, this just the change. I took fat out of her lower eyelids and then added it to her mid face, and you can see. I'm not sure what they were trying to do, but it definitely didn't give her the result that she was looking for. So I think now she looks much kinder to really match her personality, and she was very happy. So why is fat grafting interesting? I think I've said this about 5 times so far, but I just have to stress it again. You're taking fat away from places that you don't want it, and you're putting it in places that you do want it. It's your own natural tissue, and it's a great building block. It's soft and can really do very nice things if placed in the right places. So going back to the procedures I perform: facelift and neck lift, brow lift and blepharoplasty, rhinoplasty, aesthetic breast surgery, male chest surgery, abdominoplasty, liposuction, Brazilian butt lifts. And again, most of these, if I can find a place to use fat in my procedures to give a patient a better result, I will. I still haven't figured out how to use it in rhinoplasty just yet. So some take-home points. Fat grafting is versatile. So I think I showed you about 10 different ways you can use it, and I could probably name 10 more off the top of my head, and there are definitely more ways to use it. It can be performed alone as a natural alternative for facial fillers, so it can be done wide awake in the office, and you can use it similar to facial fillers. And it can be formed as an adjunct to traditional cosmetic surgery, and that's kind of what I was trying to show you today, all of the different surgeries that I perform and all the ways that I've used fat to help my results. It can be formed under local anesthesia or general anesthesia. I think it's important to note, and I tell all of my patients this, not all the fat survives, and this varies by person, location, and a little bit of luck. I personally never overgraft, meaning if I think that 80% is going to take, I do not put in 120% and wait for that 20% to not survive. I would never want to get in the situation of that last patient where I have too much fat or fat in places I don't want it. So I'd rather fat graft once, let a patient heal, come back and do a little bit more liposuction, and then regraft in areas that I need to. And I would just say, based on that last case, just choose a plastic surgery who performs these procedures. I think fat grafting is a powerful adjunct, a powerful technique, and you should find someone who does it. If you're interested in learning more, I would love to meet you. If you want to come in and learn more, I'm actually offering complimentary cosmetic surgery consultations for the entire next month. So today is January 18th. Until February 18th, I am offering cosmetic surgery consultations for free. So please just mention the webinar when booking your appointment. Again, even if you just want to learn more and not thinking about doing anything for quite a while, these procedures are complex and really very tailored to the specific patient and their needs. So I can give you a sense if you're a good candidate for any of these procedures. A few citations for some of the work that I showed today. And then I think I'm going to leave time for some questions. So I just want to thank all of you for tuning in tonight. I know that your time is very valuable, and I know that it's meaningful for you to be here. So here's my contact information. You can call the office at 212-686-7306. This is our address, or you can go to laserskinsurgery.com to learn more and to schedule an appointment. But again, I appreciate your time. I know all of your time is valuable, and I really do appreciate you tuning in to learn more about this exciting part of plastic surgery. So thank you so much.
Great. Thank you so much, Dr. Wilson. That was amazing. And it was really nice to see all those results about, especially in combination, about how you're using fat transfer. So we do have a number of questions here. Before we get going, I just want to remind everyone else, this is the time. Use the Q&A feature on Zoom. Any questions you would like to ask, perfect opportunity. And then also not to forget that Dr. Wilson is generously offering complimentary consultations for the next month. That's a really great value. You can get one-on-one time with him, and he can come up with a customized plan and quote for you. So I very much encourage everyone on this webinar to take advantage of that. So let's get into the questions. First, Dr. Wilson, did you say you can do hand rejuvenation with fat transfer?
Absolutely. It's funny because a lot of, especially facelift patients, their face looks great. They've gone and got their laser treatments after, their skin looks great, and then their hands, and we all know as we age, the skin on the back of our hands becomes very thin, and you can really tell someone's age by their hand. And so even under local anesthesia, you can go add fat to the tops of the back of your hand and really plump up that skin again and hide the veins and really make hands look younger. And so it's not a procedure that's super popular, but I think it's going to become more and more popular as more people understand its value.
Yeah, absolutely. Okay, the person that asked that question said that is exactly her story. Skin's great everywhere, just very thin though. So
Exactly.
Perfect. All right. What makes someone a good candidate for liposuction and fat grafting?
So a good candidate, I do not think that liposuction and fat grafting, it is not weight loss surgery. So a patient that comes in with very high BMI who says, I've just been out of control. COVID really got the best of me. I'm ready for my liposuction. I tell them we need to hold off. I look at liposuction as an artistic venue, a endeavor. I look at it as more sculpting than anything else, and I think it's more about the shape. And so I don't look at liposuction from a weight loss perspective. I look at it from from removing, creating negative spaces, and then the fat grafting takes it one step up. You're now not only taking care of the negative spaces, but you're adding positive spaces. So again, taking it from areas that you don't want it to areas that you do want it. So I think a good candidate for liposuction and fat grafting is someone with a little bit of fat, but someone more that wants to alter their shape than actually their weight or I think that's kind of the best way to look at it.
That makes sense. I think that's really good for everyone to remember. All right, well, here's a good question that some people might be confused about. Are you with laser skin surgery, or do you also have an office up on Park Avenue?
So that is a great question. I feel very lucky that I kind of have the best of both worlds. I'm with this great faculty here with laser and skin surgery, probably the best dermatology practice in the city, if not maybe the country. With the best dermatologists that there are. And so I'm here 2 days a week and I'm uptown 3 days a week. But if you want to come see me, I'd be happy to see you at the Laser and Skin Surgery Center.
Especially for the complimentary consultation part of this webinar.
Exactly.
All right. How long does fat typically last, and what are some of the complications that you mentioned?
Sure. So that's a great point. I think I think I mentioned this. So fat, anywhere between 40 to 80% of fat will take. And what does take mean? Take means find a blood supply and graft, live there. The good thing is, you might say, well, 40%, that's not great. I've never liked 40% of anything in my life. But I'd argue the exact opposite. You're taking it away from areas that you don't want it, and then you're adding it to places you do want it. And that, even if it's 40%, even if you're on the low end of that graft take, that fat that lives, that's yours forever. And so while you might be a 30-year-old who's doing fillers for the next, every 2 years for the next, 50 years, the fat that we add is fat that now is going to be yours forever. And so yes, the graft survival might not be 100%, but it's also the fat that does survive is now yours. So, and I think that's why it's such a powerful procedure.
That is powerful. Okay. And the second part of that question was, what are some of the complications that you mentioned?
Yeah, I think a lot of the complications, similar to liposuction, again, depending on the volume. If you're doing full body liposuction, all the complications of liposuction, and whether that's the big ones where, bleeding, infection, damage to local tissue, obviously rare, but can be serious. More so, the more aggressive you are with liposuction, the more likely you are to cause small contour irregularities. And I work my hardest. It really keeps me up at night, and I don't take any part of these surgeries for granted, and I concentrate the whole time because I don't want to create lumpy bumpiness of the skin. Even so where some people might say it's just liposuction. I think liposuction is an art, and I'm meticulous about it because I want to give it the least amount of evidence that I was there. I'd rather it look like that was the body that you were given with before I met you. And so I think some of the complications, for the most common complications of liposuction would be contour deformities if done incorrectly or done too aggressively. Some of the complications of fat grafting, I think I showed one where fat was put in the wrong place and it survived, and it gave someone a look that they didn't love. And then similar to fillers, there's whenever you're injecting a substance, whether that's filler or fat in the face, you always worry about injecting it into a blood vessel, which can cause tissue loss, or injecting it around the eye, which there have been, both with filler and with fat, there have been accounts, and again, this is like getting hit by lightning, but I'd let every patient know, there have been accounts of irreversible blindness with injections of the face, and that's true of filler too. And again, that's very, 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 very unlikely, and there are only a couple of cases in the literature, but it's something that I let every patient that I'm going to inject know, because it's a joint decision process, and it's a decision that if you're going to have fillers or you're going to have fat, you should know.
Absolutely, and reinforces why it's so important to go to an expert here. All right, here's a great question. I'm sure a lot of people will be excited to hear. Is this ever covered by insurance?
So fat grafting can be covered by insurance, but I will caveat that it's very specific situations. If most of the results that I showed today were had to do with cosmetic surgery, but if in patients who had breast cancer, using fat for breast cancer reconstruction, or from using fat in a way to help hide scars. These are ways in which fat can be used medically for medically necessary procedures, and then ultimately sometimes, and again, no promises, but sometimes covered by insurance.
Great. All right, some more options for fat grafting. Here's a question. Can fat grafting be used for chin fat? Yes,
fat can be used for chins. I tell my patients, so it all depends on the volume you want, similar to the breast. So if someone has microgenia, which is a small chin, the best, depending on how far you want that chin to come out, can kind of lead to what you want to do. You can, obviously, in a similar way, you can use filler, you can use fat, and I would say that it would only be helpful in a situation where you want 2 millimeters of projection or less. If you wanted more than 2 millimeters to get your chin out, then a small incision underneath the chin, dissection up. It's again a surgery, but a chin implant to give you more than 2 millimeters. But if you wanted a small augmentation of your chin, filler or fat works very well.
All right. How about for dark circles under the eyes?
Okay, so this is great. So everyone says dark circles under their eyes, and there's a lot of people mean different things with this. What I will say is that lower blepharoplasty, and I tried to show it, but again, it's really, people that suffer from lower eyelid bags, if they go take a photo with a really big flash, all of a sudden it's gone. But that's not how you walk around. You don't have a big flash on you when you're walking around. So when the light hits you from above, you look tired. And so I was trying to show that with the photography, but it's difficult. But basically, when the lower eyelid bags it's hypertrophy of the fat of the lower eyelid, and so that causes a shadow onto your cheek. So the combination of removing or making those fat bags smaller, either from the outside or scarless from the inside, depending on how much extra skin you have, plus adding volume to your cheek and your midface, totally changes the dynamic. So instead of being big here, small here, now you're doing a minus plus. So you're minus in your lower eyelid, plus in your cheek, and then all of a sudden now you don't look tired and you don't have those big under eyelid bags. So I think it's a really great. It's a really great for lower eyelids.
Great. That makes me very personally interested. That sounds great. All right. How about deep forehead wrinkles?
Deep forehead wrinkles. Deep forehead wrinkles are tough. I think that in general, forehead wrinkles, probably many people on this webinar, if you're here, you've probably at least tried to do a little Botox, and I think Botox works well. Botox is obviously a neuromodulator. It makes the muscle less active. It effaces a lot of the wrinkles, gives it a softer look. Some people over many years have very deep forehead. What I would say is that I have fat grafted the forehead to give a to kind of give a better covering of everything, to kind of hide them better. I've done it in conjunction with facelift. Because your forehead is pretty sensitive, really I wouldn't do it under local anesthesia. And it's not, I don't promise much when I do it. I think it helps, but I think it's a lot of effort for something that Botox really does, 90% of the heavy lifting.
Yeah, that makes sense. All right, last few questions here. And if anyone wants to get their question in before we wrap up, this would be the time. All right, if you know only 80%, up to 80% of the fat will take, do you normally perform the treatment multiple times?
So you can, and I mentioned this, I really never want to get in a situation where I have too much fat, because too much fat is very hard to deal with. So I graft until what I think is aesthetically appropriate and aesthetically nice. And then if 80% of it takes, that's still a home run. So yes, if you go in and you do fat grafting and you don't have as much volume as you want, it's something that can very easily be done again. It's not like one of these things where, doing a secondary facelift or a secondary nose is, a big undertaking. Doing more fat grafting is not, it's really not a big deal. It's just similar. It's in terms of the difficulty compared to the first time around, it's not very different.
Interesting.
Something like a secondary nose, that's a big surgery.
Yes. That's nice. So if someone wants a more conservative approach, they could do a little bit at a time and go slow.
Totally fine.
Love that. All right. In addition to the chin, can you add to the lower jaw and under the small chin?
Yes, absolutely. So you can do it deep onto the jaw, and you can really sculpt this. And so the combination of bringing this out, plus even doing a little liposuction under here. So through a small incision, a couple millimeters, do a little liposuction here, plus adding fat to your jaw. Next thing you know, you're really, again, it's the plus minus. You're a couple millimeters down here, a couple millimeters up here, and you're really changing the dynamic of that area.
Ooh, for those of us on Zoom right now, I'm sure many of us agree. We would all love that. That sounds lovely. All right, last question for the day. Are there certain areas where fat will last longer than others?
Yes, that is a great question. And so fat will definitely last longer in places that fat normally lives. So I think that's one good point. So places like the butt or the breasts are great. Places like the deep malar is great. The places that fat doesn't take well are places that move a lot. So it's a living tissue. It needs to find blood supply, and it needs to, you would imagine anytime you have movement, you have shear, especially in the early engrafting period, that makes the fat less likely to live. So while I would love to say that fat is great for the lips, I've been less than thrilled with the fat grafting take to the lips. And so I would prefer to use filler in the lips, similar with the temples. I do get some take in the temples, but it's not as much as I would like. Just because every time you bite down, you imagine the temporalis muscle moves, and so it's similar to your lips. It's a place of a lot of movement. Whereas if you go put fat here onto your zygomatic arches, there's not, even with smile, there's not a lot of movement there, and it actually works very well.
That's really interesting. Thank you. All right, I said last question, but one more just came in. Can you use fat after an implant removal and lift?
Absolutely. That is a great procedure, and a really nice. It's really nice. So basically, you have to. It depends well, first of all, it depends how much fat you have. It also depends how big that implant was. Obviously, if you had a reasonably sized implant, you go take the implant out, you do a lift, get someone more youthful, and now you don't have that implant in there. And then you can go fat graft at the same time to give more volume. I mentioned it, fat grafting to the breast, I don't call it a true augmentation, I call it a boost. So with an implant, you use a 300 cc implant. Now you're talking 2 cup sizes up or about. I would say 3/4 of a cup size up with fat, up to maybe 1 cup size. But I do not promise, 3. If someone wants 2-3 cup sizes up, then fat grafting alone is not going to do it. But a lot of patients, when they get older, they don't want their implants anymore. So getting the implant out, getting some of that capsule out if it's diseased, and then doing a little lift and adding fat is a really, really nice alternative to just a lift alone. And it usually can be safely done at the same time as the lift. But in certain circumstances, I would do it in 2 separate procedures if I was worried about the viability of the skin or nipple.
I love it. That is great. Thank you so much for all that information. All right, everyone. So the time has come for us to wrap, but I want to remind you that this is being recorded. We will send it to you in case you want to relook at any of those before and after photos, or hear what Dr. Wilson had to say, or share with someone else that might be able to benefit from it. Again, don't forget, he has generously offered to do complimentary cosmetic consultations for the next month. So you have until February 18th to make an appointment at Laser Skin Surgery Center to come see Dr. Wilson. Can the complimentary consultation be done as a televisit?
I would prefer, potentially, but I especially with something like fat grafting, being able to really see and feel and make sure you don't have a hernia, and there are a lot of medical reasons why and safety reasons why I think that in-person consultations are better.
Okay.
But yeah, so I mean, I'm willing to talk to anyone though. If you have trouble getting in, or if you're far away, then I'd be happy to talk to you.
Okay, that makes sense. So everyone, there's now no excuse not to make a consultation with Dr. Wilson. So thank you so much for offering that. Also, before you all go, I just want to remind you that at the Laser and Skin Surgery Center of New York, we have a team of wonderful board certified dermatologists, and we also have Dr. Wilson and Dr. Hoffman as our plastic surgeons, and they both are well-versed in fat transfer and a lot of the procedures that Dr. Wilson mentioned today. And to continue our webinar series, you are all the first to know that on February 8th at 6:30 p.m. East Coast time, we have another webinar with Dr. Elliot Weiss, and he will be speaking about permanent makeup removal, which means either your eyebrows or eyeliner or lipstick or any kind of permanent makeup, which has become a really big request that we've had in our office lately. So I hope that topic will be interesting. So mark your calendars, February 8th at 6:30. And otherwise, Dr. Wilson, thank you so much for sharing all your expertise with us. Your photos are so impressive. They really, I hope they make everyone feel really confident to be in your hands. And I look
really
forward to, and I look forward to seeing some of you all that tuned in today in the office. And I hope you all have a really good rest of your weekend, your day, your Tuesday.
All right. Thank you all for tuning in. I really appreciate your time.
Thank you so much. Bye.